Hello friends, I am Dr. Praveen Ravishankaran, consultant surgical oncologist and robotic cancer surgeon. I routinely perform advanced, minimally invasive and robotic surgeries for cancers involving lungs, gastrointestinal tract, gynecological organs and urological system. My work as a robotic cancer surgeon places me at the very end of the disease spectrum, where lifestyle choices made years earlier finally declare themselves as cancer. Welcome to my YouTube channel, The Wellness Oracle. This channel is an effort to shift the conversation upstream from operation theatre and ICUs to awareness, understanding and prevention. Because as a surgeon, I can remove cancer, but as a doctor, I would rather help prevent it. Today's video is especially important because we are discussing vaping, a habit that is rapidly increasing among youngsters, teenagers and women, largely because it is marketed as safe, modern and harmless. Vaping is often marketed as a safer alternative to smoking, a clean, modern habit. Just water vapor, companies say. Many people who would never have smoked a cigarette are comfortable vaping. I will tell you what companies don't tell you. I am concerned about your health, as should you be. Today, you will understand vaping using a simple physics experiment, a movie scene, and finally, scientific and medical evidence that throws light about vaping and its ill effects. So, let me start with a simple physics experiment. I light this candle, then I blow it out. The flame is gone, but watch carefully. If I bring a flame close to the smoke coming out of the candle wick, wow, the flame travels through the smoke and reignites the candle. This smoke is not just harmless air. It contains combustible particles and vapors that can carry energy and ignite the fire. Remember this visual. It is a powerful explanation about what I am going to talk about vaping. Now imagine this smoke is vape aerosol. Most people would call it vapor. Scientifically, this vaping aerosol is actually a mixture of fine particles, heated chemicals and volatile compounds. So, just like the smoke from the candle, it carries different harmful substances that travels and penetrates spaces you cannot see. Your lung behaves like that exact wick. Let us now look at a cinema. In the movie Tourist, there is a scene where vaping is shown very casually.
You might be smoking. It's not a real cigarette. It's electronic. It delivers the same amount of nicotine, but the smoke is water vapor. Yeah, water. LED light.
That's somewhat disappointing.
This movie has two of the most versatile actors like Angelina Jolie and Johnny Depp. It looks stylish, relaxed, modern, and totally harmless. There is no warning, no coughing, no immediate consequences. Cinema shows the moment, but medicine deals with the aftermath. And here is the key point. New habits feel safe not because they are safe, but because their consequences are delayed. Now, let us understand what vaping really is. What is inside a vape? Vape liquids usually contain nicotine, propylene glycol, vegetable glycerin, flavoring chemicals, etc. When heated, these substances break down to form formaldehyde, acrolein, acetaldehyde, ultrafine particles, heavy metals from the heating coil like nickel, lead, chromium. This is definitely not water vapor as the companies say. It is a chemically active, super harmful aerosol. So these vape particles are extremely small, able to reach deep into the alveoli. Once inside the corners of the lung, the vapors cause inflammation and damage to the alveolar lining. They disrupt normal immune defenses. This has led to a condition now recognized as e-cigarette or vaping associated lung injury. Patients present with severe breathlessness, chest pain, fever, sometimes respiratory failure requiring ventilatory support. Some have even died. Now, coming to vaping and its relationship to cancer. Vaping is a relatively new practice, so long-term data is still evolving. But science already shows vaping causes DNA damage, oxidative stress, and cellular mutation. Studies have shown that nicotine itself promotes tumor growth, increases angiogenesis, makes cancer more aggressive. Vaping is not cancer-free, it is data immature. And in medicine, lack of long-term data is not reassurance. We have to know that. Beyond affecting the lung, vaping affects heart by increasing heart rate, blood pressure, and causes endothelial dysfunction. It affects the brain, leading to addiction, impaired attention, and very drastic mood changes. Nowadays, teens and adolescents do vaping often for the style factor, which is not good. Teenagers are not just small adults. Their bodies, and more importantly, their brains are still evolving and developing. The human brain continues to mature until around 25 years of age. Nicotine exposure during this period alters the brain wiring, impairs attention span and memory. It also increases anxiety and mood disturbances and reduces impulse control. This is not just theory, this is neuroscience. Nicotine overstimulates dopamine pathways, making the teenage brain more prone to addiction, more vulnerable to substance dependence later in life. A teenager who vapes today is more likely to smoke cigarette later, more likely to use other addictive substances, and less likely to quit successfully. There is evidence to prove that vaping does not prevent addiction. It primes the brain for it. Now let us talk specifically about women. Women are increasingly targeted by vaping advertisements because vaping is discreet, it does not leave behind a foul smell, and it is associated with stress relief. Medically, this is extremely concerning. Nicotine affects women very differently from that of men. In women, vaping is associated with hormonal imbalances, menstrual irregularities, reduced fertility, and increased risk of pregnancy-related complications. During pregnancy, nicotine exposure reduces placental blood flow, increases the risk of low birth weight, increases the risk of preterm delivery, and affects fetal brain development. We should know that there is no safe limit of nicotine exposure in pregnancy. That is the bottom line. Many people say, I don't smoke, I only vape. But nicotine addiction is the same. Vaping often delivers equal or higher nicotine doses with less irritation, leading to more frequent use. This creates a false sense of control. Vape aerosol also passively affects children and pregnant women who intake the smoke in closed indoor environments. Like cigarette smoking, there is no safe limit of exposure for this too. Scientific studies have demonstrated that vaping causes increased inflammatory markers in vapors, DNA strand breaks in lung cells, impaired immune responses, increased susceptibility to infection, etc. Global health agencies have now clearly stated that vaping is not harmless and should not be considered safe. Now let us return to our candle experiment. When a candle burns, it releases hot gases which contains combustible vapor. The smoke forms a pathway of flammable microsubstances. When we introduce a flame, the fire travels along the vapor trail and reignites the wick. The vape aerosol behaves the same way. They carry harmful substances and they penetrate deep and interact with the tissue. Physics explains how it enters. Biology explains why damage follows. Vaping feels safe because it is new, because it smells better, because it looks cleaner. But the lung does not care about appearances. If smoke and vapor can carry fire, they can carry diseases too. Perhaps the most dangerous aspect of vaping is actually normalization. When teenagers see peers vaping, celebrities vaping, movie characters whom they consider as icons vaping, the habit stops looking like a risk and starts looking like a lifestyle choice. So, let me conclude with this. As a robotic cancer surgeon, I work with cutting-edge technology to treat advanced diseases. But no robot, no surgery, and no medicine can undo years of preventable damage completely. Vaping feels modern, it feels controlled, it feels safe, but delayed harm is still harm. This channel, Wellness Oracle, exists to help you understand before the damage begins. If you have found this video informative, please subscribe to the channel. Share it with your family, especially youngsters. And turn on the notification because upcoming videos will cover lifestyle habits, addictions, and cancer prevention in a simple but scientific way. Your subscription helps this message to reach the people who need it the most. So please do subscribe. So finally, understand your health, question recent trends, and protect your future and your families. Thank you for watching. Have a nice day.